3-year-old girl is brought to the emergency department due to pain and fever. 2 days ago, the patient developed mid-abdominal and back pain. The fever began yesterday and reached 40 degrees last night. Over the past 8 hours, she has 8 episodes of emesis, but since tolerated a few sips of water. The patient has a history of constipation. In the since the start of toilet training at age 2, and has pellet-like stools once a week. She has frequent urinary accidents during the day and night. The patient takes no medication but has no other medical condition. Vaccines are up to date. Temperature is 40, BP is low, tachycardia. Physical exam shows tired, appearing cold with dry mucus, right vertebral costal and tenderness. So a lot going on over here. Pain, fever, abdominal pain, mild abdominal pain, back pain. The fever began yesterday in the morning, reached 40. She had 6 episodes of emesis, and and she has a history of constipation. Starting in 2, lab values, leukocytes are elevated. We can see she's basically having a ketones positive, nitrates positive, white blood cell and RBC is also positive. Blood cultures are pending. 20 saline is administered. She faces another episode of emesis and void in the emergency part. What's the best next step? Admit for IV antibiotic due to the patient's age. I could go for that. Admit for IV antibiotic due to the patient's temperature. That could also be admitted to vomiting. Discharge on oral antibiotics and immunemic, and we can see the perform oral antibiotics hemodynamically and perform urinary tract urine prior to antibiotic. She's 3 years old. I don't know. It's a urinary tract infection. She could have meningitis, but she has also all this positivity here. She's 10. No, she doesn't have. She definitely doesn't have meningitis because she has all these symptoms of UTI. Age or what? Should we give for age or for her temperature? What do you want to give for age or temperature? She is 3 years old. She is having temperature. I'll go for age. I don't know. I'm wrong. Yeah, damn. Okay. Patient warm, so she has meningitis, right? No, okay. Let's look at the objective. Pyelonephritis and urinary tract infection. It presents with fever, nausea, vomiting, flank pain. Okay. IV antibiotics are indicated for patients who are unable to tolerate oral medications. Oh, she can't tolerate oral medications and do not improve oral antibiotics and hemodynamically unstable and are less than 2 months. Okay, got you. Okay, that does make sense. So she cannot tolerate.